my name is Shannon Ferguson. As a long-term LEM trainee at the UC Davis Mind Institute, I will be presenting my LEM project for this year. I received no outside funding for my project, and there is nothing to disclose. Today, I will be discussing my project with Captain's CARE project in relation to preference assessments. The purpose of this project is to find ways to assess the preferences of adults with neurodevelopmental and intellectual disabilities regarding evidence-based practices, specifically visual supports and prompting. Evidence-based practices, or EBPs, are practices or interventions that are based on scientific research. In the field of education, utilizing the expertise of professionals and the scientific method, educators are able to implement interventions that are backed by empirical evidence. A few examples of EBPs for autism include prompting, visual supports, and reinforcements. However, my project was to focus on prompting and visual supports, but reinforcements are also discussed. I will give an overview of what prompting, visual supports, and reinforcements are. Prompting is about providing assistance to the learner to help them acquire a skill. Visual supports are visual displays that help learners see what is expected behavior or what are upcoming activities. Reinforcements can use rewards and consequences to encourage a learner to use a skill. Members at the California Autism Professional Training and Information Network, known as CAPTAIN, have started the CARE project, which is the Captain Adult Resources Evaluation Project. There have been requests from regional centers for training resources so they can provide more support for their adult clients with developmental disabilities. EBP research focuses on implementation with children and not with adults, so Captain started a pilot study to train a few regional centers to use the chosen EBPs of visual supports and prompting with their adult clients, then measure if the clients reach their goals. The regional center sites increased their use of the EBPs after the intervention. By the end of the program, 92% of client participants in the study met or exceeded their goals. These results are very encouraging for adult service providers and adult clients looking for stronger support. However, the question given to me when I joined Captain's project was related to agency and choice for adult clients. EBPs may be based in research, but which evidence-based practices do adults with disabilities prefer, and in what way? I was tasked with finding out if there are methods or assessments for adults with developmental disabilities to indicate their preferences for EBPs. This could mean which EBPs they prefer to have implemented, or this could mean how a specific EBP is utilized, because an EBP, such as visual supports, can have multiple ways to be implemented. I was told to keep in mind that Captain would prefer an assessment for adult individuals who may not be able to verbalize their preferences. Being able to consider the preferences of neurodiverse individuals can help move towards neurodiversity affirming care. My project turned into a literature review of preference assessments for EBPs, specifically for adults with intellectual and developmental disabilities. During my search, I tried to find research articles on preference assessments for evidence-based practices with adults with intellectual and developmental disabilities. I later tried to search for visual supports and prompting to be more specific. While I found some research related to preference assessments of EBPs, most research focused on reinforcements, and there was minimal to no research on preference assessments for visual supports and prompting. Also, the vast majority of studies I found were with children, not adults, and some studies were from the 2000s. The main types of preference assessments I found focused on reinforcers and children with disabilities. On the right side of my slide, there is a flowchart on choosing the type of preference assessment based on what is already known about the individual's interests. These preference assessments may be possible with other types of EBPs, but more research will be required. I will explain each of the types of preference assessments for reinforcers that I found. Comparing single and paired stimulus, a single stimulus preference assessment gives the individual one item at a time, then recording the individual's behavioral response to the item. A paired stimulus preference assessment gives an individual two items and requires the individual to make a choice. The chosen stimulus would be seen as the more preferred item. There is a type of preference assessment with multiple stimuli where items are replaced. An individual is given 3 to 4 items and must choose one item. The items that were not chosen must be replaced with new items, and the chosen item is placed with these new items. The individual must choose an item again, and the items that were not picked are replaced. This process is repeated until the number of trials is complete with each item shown at least a few times. Multiple stimulus preference assessments can also be done without replacement of items. Multiple items are placed in a row, and an individual must choose one item. That item is removed, and the individual must choose another item that is left over. This process is repeated until there are no more items. This allows a hierarchy of which items are preferred over others, with the first few trials having the highest preference. Free operant preference assessments use multiple items, but the individual is allowed to interact with the items as they please. The amount of time the individual interacts with each item is recorded. Items with a greater amount of time of interactions would be seen as being most preferred. My explanation of each of these types of preference assessments were mainly ways to check for potential reinforcements, which is not the EBP of interest. During my literature review, I found very little research of preference assessments of visual supports and no research for prompting. I found one study that was about using different visual supports in classrooms with 5 to 7-year-olds who are at risk of emotional and behavioral disabilities. This is not the population of interest, but may give some insight on ways to do preference assessments for visual supports. Prior to the study, the researchers used preference assessments to determine which visual schedule to implement as the intervention. During the study, the researchers used multiple stimulus without replacement or paired stimulus preference assessments for visual activity schedules, which could be in the form of a book, a traditional method, or digital. The chosen visual schedule was used in the classroom. No preference assessments were used for structured visuals. My literature review did not find many methods to assess preferences for visual supports and prompting in disabled adults, which means there's a lot of research that needs to be conducted in this area. There's a need to research methods to assess preferences for adults with disabilities in different evidence-based practices. When considering possible ways to assess the preferences of adults with developmental and intellectual disabilities, at this point I have a few recommendations. There are intellectually disabled individuals who are able to read, so for these individuals, I would recommend using surveys written in plain language and using visuals or pictures. This year, there have been workshops at the Mind Institute on the importance of plain language to make writings more accessible for the people we try to serve. If someone is unable to use a survey and can't say their preferences, then it may be possible to use the preference assessments that I went over in this presentation. More than one preference assessment can be used. For example, we can use single stimulus and multiple stimulus without replacement preference assessments for visual supports to get more information on how the individual uses and prefers a visual support. No matter which preference assessment is chosen, it's important to make sure that the practice is age-appropriate and respectful of the interests and preferences of the individual. Here are my references for my project, and thank you for your time.
The UC Davis Mind Institute was founded in 1998 with the promise to reduce and prevent the disabilities that can be associated with autism and other neurodevelopmental conditions. Every day, our clinicians and researchers make progress on that promise. Our groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other conditions associated with disability are helping affected individuals achieve their fullest potential. Please visit our website or our social media platforms to find out more about current studies, upcoming events, and how you can help make a difference.